So what sort of increase in mental health presentations to emergency departments have there been?
Oh, there's been a significant increase over the last 7 years, which is really disappointing. We released a report 7 years ago highlighting the extreme length of stay that people suffering from mental health problems have in our emergency departments. We called for action back then, and 7 years later, we have performed the report and things have got significantly worse. It's really disappointing, Ross.
So how much have wait times for beds increased by over that time?
Well, we've not found that certain states there's significant length of stay where it's requiring 23 hours for 90% of people who need admitted to actually get to a bed. So we think the emergency departments are not therapeutic environments for people suffering from mental health crises. So we need to get them the care that they deserve in therapeutic environments.
So what happens to people who present to ED and there isn't a bed?
It's the opposite of a therapeutic environment for them. EDs, by necessity, are the lights are always on. They are noisy. There are people screaming in pain in other parts of the emergency department. There are limited access to showering and toilet facilities as there would be in a normal ward. And sometimes these people are spending multiple days in emergency departments. I think for most of us that work in large emergency departments, every Monday morning, if you come on shift, there'll be somebody that will have been kept in our emergency department since Friday afternoon, waiting for inpatient mental health care that they deserve.
And these are mainly acute cases, are they?
Yeah. Our report has highlighted that more people are coming to emergency departments with mental health problems, and they are sicker, they are more complex, and it's disproportionately affecting our First Nations, Aboriginal, and Torres Strait Islander populations as well. So we need some urgent call for action.
So we mentioned 3 states where the problem is particularly acute. That's South Australia, WA, Tasmania. Why is the issue particularly bad in those places?
It's bad almost everywhere, to be honest. I don't want to particularly highlight those states. A shout out to the ACT have made small improvements in certain aspects of this, but almost every other state and territory have had significant declines in their performance of emergency departments. It's taking us longer to get to see these people from the waiting room, and it's taking longer for those that do need admitted. It's taking longer for them to get to therapeutic environments on the ward or in the community.
And Peter, why are so many more people going to ED with mental health issues instead of finding help from elsewhere in the system?
It's a chronic lack of underinvestment in the community is the underlying problem here. We absolutely need more inpatient beds at the moment as well, but the underlying problem is that there has not been enough investment in community mental health to meet the increasing needs of the community. And this needs to change, otherwise we're just going to be having the same conversation in another 7 years.
Are there mental health initiatives, though, which are working? You mentioned small improvements in the ACT and which could be expanded.
Yeah, there are lots of examples of good practice that's happening throughout our states and territories, including alternates to the emergency departments, such as safe haven cafes that people suffering from mental health crises can go and get a supportive, safe environment that's much more therapeutic than a noisy, bright emergency department, and perhaps even avoid having to go to an emergency department or get admitted to a hospital. So we need significant expansion in community mental health services to try and reverse this trend.
What are your fears for the future if no action is taken?
If no action taken, we are going to have emergency departments full of people being exposed to an anti-therapeutic environment, which is bad for their mental health, making them sicker and making their hospital stay even longer with negative outcomes from that.